This is Section A, Calculations Overview and Math Assessment. Knowledge in basic math principles is essential in this course and in nursing in general. It is necessary to correctly calculate medication doses. This is a brief review of some math skills that you should have already learned previously in your prereqs. These are your objectives for this section. Please read them thoroughly. And these are your assignments. Number 1, complete the Calculations Math Assessment pretest provided to you on Canvas. Number 2, review or learn basic math skills. So use your pretest results to guide you where you need to improve on. And lastly, complete your ATI Section A Med Math assigned homework or assignment. This is Section A, decimal point values. So this is just basically an illustration of your decimal point and their place values. So you have your whole numbers here. So you have your millions, 100,000s, 10,000s, thousands, hundreds, tens, and ones. So you can see this is where your decimal point is. And the first number after your decimal point, that would be your tenths. Second number would be your hundreds, and you have your thousands, 10,000s. What I can tell you is that in calculations, what we usually want to make sure is that you know your tenths and hundreds. Of course, we're going to let you know otherwise if we need additional numbers, but this is usually where our focus is, knowing where your tenths and hundreds are. This is Section A, rounding rules. So this page right here will give you, or these pages will give you basically the rules that you will need to know in doing your med math and how do we round our med math calculations. The first rule is documenting with calculations. So all answers must be labeled correctly for what you are solving. What do I mean by that? So if it is asking you basically to solve how many tablets, when you are done with your final answer, you want to make sure that you write, let's say for this one tablet, right? Or if it's asking you for a volume, then you want to write 5 ml. 5 ml. What I don't want to see is, this is your final answer. So, because then 5 of what, right? It can be 5 of anything. So you want to make sure you label it. You have your units of measurement after your answer. Number 2, do not round any numbers until the end of the problem unless you are converting weight. If you are converting weight, we'll talk about it more in the rule number 5. So this rule is pretty straightforward. Basically, don't round until your final answer unless we're talking about weight conversion. So there's going to be a different rule for weight conversion. Number 3, basic rounding with decimals. No trailing zeros and no naked decimals. Examples: a correct way of writing 4, as you can see here, is just 4. What we don't want to see, or the incorrect way, is writing 4.0. So another example for that is, if your answer, like earlier, is 1 tablet, that's what we want to see. We don't want to see 1.0 tablet. Guess what? What can happen is somebody may not see this decimal point and they may think it's 10 tablets, and that's going to be a huge medication administration error. So no to that. Now, no naked decimals. What do we mean by that? So as this example, what we want to see is, if you have something less than 1, or you have something less than 1 in decimals, you want to write the 0 before your decimal point. What's incorrect is not writing a 0, like this one. So correct way is 0.12. The incorrect way is 0.12. Because again, so this is the correct way, 0.12. Because if somebody writes 0.12 and somebody doesn't see this right here, 12, that's a lot, right? So we don't want that. We want to make sure that you write your 0 if it's less than 1 when it comes to your decimals. For the most part, we would require you to round to the nearest tenth unless otherwise instructed by your other instructors. But for the most part, we use the nearest tenth. There's another rule regarding that later on. It's regarding your pediatric patients. But in general, we round to the nearest tenths. So what is the rule for that? Well, if the digit in the hundreds place is equal to or greater than 5, you round up. So an example is you have 1.57 here, it becomes 1.6. Now, if the digit in the hundreds place is less than 5, you round down. So you have 1.54 here, it becomes 1.5. A common mistake that people will do is 1.54, and we ask them to round to your tens, nearest tens. Some people, when we say round down, they do this. No, that's not what we mean. What's going to happen is, what we want you to do is rounding down means just going down to here. Okay, so another example. 2.72. Now, if you see here, this is less than 5. So if you want to round it to the tenths, we do this. 2.7. All right. Another example. 3.51. All right, so this is less than 5. So your answer would be 3.5. That's your answer. That's your answer. Again, we don't round down like this. This is what we mean by rounding down. Rule number 4, liquids. If it's greater than or equal to 1 ml of fluid, round to the tenths place. What we want to see, let's say they're asking you do your calculation, this is going to be the answer that we want to see. 3.1, right? Let's say what you came up with was 3.12, right? So this is your answer. Now, if it's something less than 1 ml of fluid, you round to the hundredths place. What do we mean by that? So if you get an answer of so if this is what you get, we want you to round to the hundredths place. So as we discussed earlier, we want to look at this number right here, and then it's less than 5, then we round down. So then this becomes 0.12. So that's going to be your answer. Now, and the reason for that is because that's really how our methods of measuring things. So if you have a 1 ml syringe, so if you want something that's less than 1 ml, you would use your 1 ml syringe. And as you can see here, it may be hard to see, but this goes by 0.2, and then these little lines right here, they're actually going to give you your hundredths place decimals. So this will be your 0.21, 0.22. So you can measure it. This is as precise as you can measure it using this device, this syringe. Now, if it's something greater than 1 ml, as you can see in this syringe, if you look at the lines, there's no hundredths place, there's only tenths, right? It's because you have 1.5, then the following line will give you 1.6 and so on. Rule number 5, converting weight. A, do not round until the end of the conversion. So example, if you're rounding pound to kilogram, make sure that you're done with it and then you can round. For B, round weight for adults to the nearest tenth. So as I mentioned earlier, for the most part, when we're dealing with adults, when it comes to their weights, you want it to the nearest tenths. Now, on the other hand, C, round weight for pediatric patients to the nearest hundredths. And do not ever, never ever, round pediatric weights to the whole numbers. That can be quite a devastating medication calculation mistake, because that can be lethal for a little baby. Rule number 6, IV calculations. So for IV infusions, they're calculated in either drops per minute, as written here, or milliliters an hour or mils an hour, as written here. So for drops per minute, it needs to be rounded to the whole number. Here, whole number. The way I remember it is, can you count drops? Like there's like 1.2 drops? Not necessarily, right? Realistically, unless you have very special devices. So drops should always be in whole numbers. Drops or right, drops per minute. Now, when it comes to ml an hour, you want to round to the tenths place. And the main reason for that is most IV pumps, where you're going to program the rate of that IV medication, it only goes as far as the tenths place. So IV pumps usually tenths place. For rule number 7, capsules and tablets. For capsules, they always must be rounded to a whole number. So why? Well, these are your capsules, right? These are your capsules. It will be hard to give a patient half a capsule just because then you'll have to open it, and there's really no accurate way of measuring and making sure that you actually just give half a capsule. So when it comes to capsules, you want whole numbers. Now when it comes to tablets, unless it's a specialized order or a special kind of tablet, for the most part, you round to the nearest half a tablet. So what do we mean by scored? Scored. This is scored. Sorry about that. This is scored. This line right here, this is what we mean when they're scored. So these are scored. Now, if this line is not here, then you can't really cut it. So if it's not scored, those are the tablets that are not supposed to be cut. So please don't cut those. All right. So this is an illustration of a pill cutter. So basically, if it's something that you can cut, you can align the score to the cutter, and that way it will cut your medication in half. And this right here is a pill crusher. So basically, you get a bag, you put your medication, and then you put the bag with the medication here, and then you start pushing down here repeatedly until your medication basically becomes powdered. So that's all the rules that I want you guys to focus on. And definitely you can use this throughout your nursing program, throughout this course as a reference. So this is going to be your go-to page in case you forgot, well, what is the rule for rounding this? Well, these are the rules. So this is section A, rounding rules. As I mentioned earlier, you have a calculations assessment pretest for this section. So if you go to your section A and you go down to assignments or activities, you have your pharmacology for nursing practice calculations assessment pretest. So this is the pretest assignment that I was talking about. Now, once you're done, you will see your scores and you will see the areas where you need to improve on. So definitely use that to know what are the things you may need to review on. And after everyone's done, I will release the answer key to your pretest, so you know the explanation of your answers.